Namaste. Greetings from Indraprastha Apollo Hospital, New Delhi. I'm Dr Gaurav Kharya and I work here as a Director Center for Bone Marrow Transplant and Cellular Therapy. Today I'll brief you about what are the preparations which are required before bone marrow transplant. So once we have identified a child, a patient who needs a bone marrow transplant, say for example sickle cell disease, this child needs to be prepared very meticulously for a successful outcome of bone marrow transplant. The better is the preparation, the better are the outcomes of transplant. If we talk about the preparation at our center, we start preparing that patient roughly around 6 to 8 weeks in advance. Once the patient comes to us, we do some basic investigations to look at the various organ functions, cardiac functions, liver functions, renal functions. So all the organ functions are assessed. And then after this, depending on whether it's actually identical donor transplants or a haploidentical donor transplant, we start the preparation. If it's a haploidentical donor transplant, we usually take a backup of his own defective cells as a safety mode. And then subsequently, we put these patients on some preparatory chemotherapy for around 6 weeks. And then we subsequently take them up for bone marrow transplant. Whereas if we have a HLA identical sibling donor transplant, then we do not take autologous backup and we directly take these patients up for the preparatory chemotherapy, which is given over a period of 6 weeks. Now, once this 6 weeks preparation is over and we take the patient up for transplant, there are different protocols which can be used. Over a period of time, we have evolved and we have come to a protocol which is now called as Apollo protocol, which is a very, very sort of refined protocol which balances out the effects and the side effects. So using this Apollo protocol, we have been able to deliver the best of the outcomes. The conditioning related toxicity is much less and the outcomes of transplants are much better.